When you arrive for your interview, you will register in the Student Union Common Room, and that is where you can wait for your interview. Usually, the student panel member will come and get you from the Common Room. Student panel members are current students on the medicine course who sit on interview panels. They can all remember waiting for their own interview a few years ago and try to be as friendly as possible.
Rebecca Raisy.
Hi.
Hi, my name's Reese. I'm the medical student on the panel. Don't worry, that was really nice.
Okay.
Interview panels are usually made up of a panel chair, as well as 2 interviewers and a student panel member. Sometimes there may also be an observer present. Typically, the chair will introduce the other panel members to you at the start of the interview. Interviews for medicine at Imperial College London are semi-structured, and the questions are designed to help the panel assess you against the criteria available on our website.
Hello, Rebecca, please have a seat. So, thanks for coming to talk to us today. My name's Kevin Murphy. I'm one of the admissions tutors for medicine here at Imperial. These are my colleagues, Dr. Saleh and Dr. Borgstein, and you hopefully met Reese already on the way in.
Yes.
So the bad news is we all have to ask you some questions. The good news is we'll try and make it as friendly as possible.
Okay.
So to start off with, Dr. Borgstein is going to kick off.
Hi.
I just want to ask you about, to tell me a little bit more about your exposure to medicine and what it entails.
Okay. So I've kind of done some work experience before applying for medicine. I spent a week at my local hospital. I spent some time in the A&E department and the clinical decisions unit, kind of spending time with some of the junior doctors and going around on the ward rounds with the consultants. But when I was there, I also spent some time with the nursing staff and with the porters and behind the reception to kind of see from all angles how the hospital worked.
And how long was that work experience?
So that was for a week, and I also spent a week at a cardiac rehabilitation centre, seeing patients after they'd had some cardiac event and how the rehabilitation process occurs.
Okay. And can you think of anything that really struck you about your time at patient that really struck you, made an impression on you?
I think that what struck me is the effect of kind of friendliness when you are seeing patients. A lot of the patients didn't mind so much about how they were feeling, it was how they were treated by the doctors when they were there. And also that kind of every patient you talk to has a story that you don't necessarily see if you don't spend time talking to them, which you found kind of impacted on their care if you didn't know kind of the reasons behind how they were feeling.
Okay. So what do you think are some of the worst things about being a doctor? What do you think?
I think some of the worst things about being a doctor are that you spend a lot of time in the hospital, you don't have so much of a social life as maybe we're used to at the moment. And it's also it can be quite emotionally difficult. You see some difficult things and you don't necessarily have the support outside of the hospital if you don't have friends or relatives who are doctors and see similar things.
And how do you think you'd cope with some of these emotional things you might see?
I'd like to think that I've got a good support network of friends around me, that even if they're not medics, I feel comfortable kind of saying, I had a bad day today, can we just sit and have a chat? And also, I find doing sport is quite kind of cathartic. If I've had a difficult day, go for a run, for a swim, I find it gives me a chance to kind of think things through, kind of manage what I'm
So
feeling.
that's how you deal with stress?
Yeah.
Talking to people. Okay. And what made you want to do medicine?
So I wanted to do medicine because I really enjoy kind of spending time with people and helping people, but also kind of enjoy the scientific side of things. I like to know how things work and also to kind of help with the process of working out, so I'm kind of a bit like a puzzle.
Well, why not another scientific subject?
I think it's the mix of kind of an interface with people and science that kind of drew me to medicine.
Thank you.
Hi Rebecca. Right, I can see in your personal statement you've mentioned a bit about your leadership qualities. I was wondering if you could elaborate on that for us.
Yeah, so I am a Lance Corporal in the CCF at my school, which means kind of I help run a particular section of the Army section. So I have a group of 8 other students who I kind of run the activities for.
Do you have any examples of any difficult decisions you've had to make that have worked really well for you?
Yeah, so I played a lot of netball and I was the team captain in my last year of school, and we did quite well. We got through to the Devon finals, and obviously a lot of my team members, also some of my friends, and when we were playing the match, one of my friends was not playing at the time. She was one of our subs, and she was kind of saying, you know, I'd really like to play, but she had played earlier in the match and she wasn't playing as well as she could have done, and the team we had on the pitch I felt was the best team at the time. So I had to make the decision to not play her in that match, which was difficult because I knew it would upset her, but I did explain afterwards that I was sorry, but actually sometimes we can't always all get what we want as the team.
Did you win the game?
We did,
Yeah.
and so it did work out well, but it was difficult because I knew that what I decided would upset someone, but at the same time, to not upset her would be detrimental to our team.
Okay, fantastic. So what about in just more kind of team-based scenarios? Do you feel comfortable in those as well?
Yeah, so as well as kind of, although I'm the team captain this year, I spend a lot of time playing netball, not as a captain. And it is such a team-based sport, kind of, it's a really good way of learning how to work with other people. And I've also spent a lot of time working at a primary school near me. I kind of volunteer there. And that involves a lot of working within a team. So there's like meetings before you go and see the children and all the staff interact with each other quite differently. So it was an interesting way of kind of getting used to a team.
Do you see yourself more as a leader or as a follower?
I think I prefer to not be leading, but I feel that when I do lead, it is something I'm quite good at. I think I prefer working as part of a team than being at the head of it.
No. I mean, you've mentioned lots of things, I mean, just now you talked about so many things that you do, and when you're studying medicine, again, you're going to have to balance lots of activities. I mean, how do you go about doing that?
So I think the most important thing for me is at the start of each week, I would write a timetable out of what I need to get done and kind of what time I have to do it in, to kind of just plan my time carefully to make sure that I know what needs to be done when, but also making sure that I've got a bit of leeway in that. So if things don't run to plan, I've got extra time to do it, but also I've got time to just kind of relax and have a bit of a break.
That's brilliant, that makes sense.
Please. You've talked about a lot of stuff you do already, and there's a lot here that we can do at Imperial. So how are you going to get involved in university life?
I think that I'd really like to join the netball team when I come. I know that there's a medics team and that's something I'm really interested in joining. I also know that Imperial College has a fencing team, and I've done quite a lot of fencing, so I think that's something I'd also like to get involved with.
Very good.
Occasionally, the panel may return to a question from earlier in the interview if they feel they would like to hear more from you about that topic. This is an opportunity for you, so don't worry if they do revisit an earlier question. It just means that the panel is interested in what you have to say.
Okay, my turn. I'm ready. Just going back to your reasons for studying medicine. So there are lots of jobs which involve science and I guess working with people, you know. And I wonder what it is about medicine. It's a long training period. It's quite a difficult job. There are lots of challenges. Just explain to me why you really want to do this.
I think it's something that I've wanted to do since I was little. I don't know that I could say there was a specific time point where I was like, this has happened and I definitely want to do medicine. It's something I've thought about for a long time. My friend's dad was a GP and he spoke about it a lot, and I think that kind of made me think about it. And then I spent time in the hospital and at the Cardiac Rehabilitation Centre. I think it was really useful seeing a lot of different kind of sides of medicine.
I'm going to ask you a more scenario-based question now. So the idea of this question is it's supposed to be trying to assess the kind of qualities that we're looking for in our doctors in the future, okay? So there isn't necessarily a wrong or right answer, we just want to discuss some of the issues involved.
Yeah.
So during your work experience at a GP surgery, you are permitted to sit in on a patient consultation. And during the consultation, the patient explains that he thinks his diabetes can be better cured with homeopathic remedies than by the drugs that the doctor has prescribed. What do you think the doctor should do?
I think that it would be important for the doctor to discuss the patient's beliefs with them, Obviously, the patient has their own agenda when coming into the consultation, and there's probably a reason why they think that maybe it's because their diabetes isn't well controlled at the moment and they're not fully understanding their medication, but also to explore what they feel about homeopathy and maybe if they're willing to discuss it, kind of what research has been done into it. So kind of explaining to the patient how important it is to control their diabetes, and the kind of methods that we suggest in medicine are kind of the ones that have the best evidence without dismissing their views, because to just dismiss them out of hand, it's not going to form a good working relationship.
No. So, why do you think some people might believe that homeopathy is effective?
I think that there's a lot of kind of people who do think homeopathy is useful. There's a lot of like homeopathy practices who genuinely believe that that is kind of a useful thing, and so if you're being told by a doctor one thing and being told by a homeopathist another, it can be difficult without your own kind of knowledge of the evidence base to know who's telling you the truth, if they're both just as kind of...
Mm-hmm. Do you think side effects might be an issue as well with drug treatment?
Yeah, so obviously a lot of medications that doctors give do have quite not necessarily wanted side effects, which can be difficult, especially if when you're not taking them you're not feeling unwell. Mm-hmm. If you then take them and you start getting side effects, it's something that you kind of not feel comfortable taking. Whereas I imagine a lot of homeopathic treatments probably don't give you those side effects. And if you're feeling well, then you're thinking, okay, I'm feeling well, I'm not getting the side effects. So you'd be more comfortable taking that.
Yes, one suspects that given the effects are probably fairly minimal, the side effects are equally benign. Okay. Do you think you should, this is a serious condition and cause serious health problems for the patient if you have untreated diabetes. Do you think the doctor should insist that they take their medication?
No, I don't think the doctor should insist that they have to take it. I think kind of a better way to go about would be explaining the condition to make sure the patient understands it, and explaining the risks of what happens if you don't take the medication, so that they can make an informed choice of whether they want to risk kind of all the bad things happening or will take their medication, but I don't think you should force them to take it.
Okay. How do you persuade them though? If you really think that's the right thing to do, how do you approach that?
I think that it's important to explore the patient's understanding and really make sure that they understand the condition itself, what's going wrong and what it can cause, and kind of explaining the evidence behind what you're saying, so kind of not just saying I think this is right and it's my opinion, kind of explaining there has been a lot of research and this is what's shown to be the most useful treatment. But I think at the end of the day, it doesn't matter how much you kind of explain that you think this is the best way forward, it is the patient's choice and they might choose to not listen to you.
Okay, thank you very much. We've all asked you a lot of questions. Have you got any questions for us?
I don't think so, no.
Okay, in which case it was lovely to meet you and you should hear back from the college within a couple of weeks.
Okay, thank you.
Okay, take care.
Thanks.
At the end of the interview, the panel will typically ask you if you have any questions of your own. You don't need to ask any, but if you do feel like there is something particular you would like to know, this is a good opportunity for you to find out. Usually the chair will let you know how soon you can expect to hear the outcome of your interview. This will typically be within a few weeks. We hope that watching an interview has been helpful for you, and we look forward to meeting you when you come to Imperial College London for your interview.